Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
Well, according to researchers at Northwestern University, only 1/3 of those in need of mental health help actually get it. And that's due in part to, barriers to care. There's simply not enough resources to give the traditional face-to-face mental health treatment that we actually know can help. So despite effective treatments, depression and anxiety continue to be huge public health problems in this country.
In this modern day and age, there may be a new solution, however. The development of behavioral intervention technologies, such as mobile apps, is expanding mental health resources for patients who need them. While not intended to replace face-to-face treatment, these e-therapies are showing promise. Here to talk about mental health and the use of e-therapy is Mayo Clinic Psychologist Dr. Craig Sawchuk. Welcome back to the program, Dr. Sawchuk. It's good to see you.
Great. Thank you for having me back again.
So, Dr. Sawchuk, the statistics would suggest that, in fact, there are more people who are mentally ill than there used to be. Is that correct? Or is it just that we are better at diagnosing it, or we're better at asking the question, or why is it? Is there really more mental illness in this country than there used to be?
Yes, all those are actually correct. I think as time is going along, the world is becoming a more stressful place, and every time we've done a new epidemiologic study, the rates of depression, anxiety in particular, seem to be increasing. So roughly about 30% of the population will suffer from at least one significant episode of functionally impairing anxiety or depression at some point in their lifetime. But true, we are also doing a better job with assessing that as well, too, and getting to people earlier than we have before.
So you've got people who finally are willing to say, yes, maybe I need some help, maybe.
Yes.
and that's a different question. But what then?
But now the problem is they can't get help.
Yeah, they can't get help. So
Exactly.
What do you have new that you have to offer them?
Well, there's a great statistic that you mentioned earlier on of all those people in the population. So around a third of our population struggling with mental illness. Access to mental health resources are very difficult, and maybe only about 30 to 40% get some degree of care. But when we actually look at the type of mental health care that they're receiving, oftentimes only 25% of those folks are getting evidence-based care within that. So there's
Evidence-based care.
Yeah, what's that?
Exactly. So whether it be if they're doing medication management for depression, usually only about 25 to 30% are actually getting the right dose of medication, and they're taking it the right way in order for it to be helpful, or psychological therapies like cognitive behavioral therapy, only about 20% of the folks are actually getting the right dose of behavioral therapy, doing the right skills that can be helpful to them.
Is it a bigger deal? I would imagine the answer is going to be both, but is it a bigger deal to have medication that helps through this time, or is it talk therapy is more important? Or is it the sandwich of the two?
It's the sandwich of the two, but there actually are some interventions that do tend to work a lot better behavioral therapy-wise. So, for example, anxiety disorders, and especially a lot of children mental health conditions, respond much better to behavioral therapy.
So that must be where these e-therapies come in, because it has to be the behavioral types of things.
Exactly, and it meets the need of the population. We think of e-therapies now as one of these part of a larger group that we call high impact, low intensity. So they're low intensity treatments because you don't need that face-to-face contact necessarily. You don't have to drive to a particular location to access those therapies, which can be big barriers to care in the first place, but they can be available to anybody, anytime, anywhere. And I think that this is definitely, as technology has advanced, so has our ability to reach these folks and really break down those barriers to care.
Is the overriding problem the fact that there simply are not enough mental health care professionals in this country?
That is definitely part of the problem. And then there's lots of other issues that I think you actually look at. The mental health consumer is also changing as well, too. Folks nowadays are a lot more tech savvy. They're a lot more kind of in the moment type of thing. So there actually may be a change in the consumer demographic of they would actually prefer more of an e-therapy approach as opposed to a face-to-face in-person approach.
So tell us what you've got. Tell us about the e-therapies that are available.
All right. So I want to talk about really, if we think about just the history of e-therapies, and there's been some changes in terms of the technology that has really driven how has e-therapy advanced over time. So we think of back in the day, e-therapy was pretty much education and text-based. It was kind of like buying a self-help book, putting it online, and just reading it. So as you can imagine, the attention span only lasts for so long. And what we're finding is with the early forms of e-therapy, people will log on once and then that was about it. But any type of technology, and especially therapy, they look at usability, like how often are you actually getting onto that site and looking at that information. So as time has developed, or as technology has developed over time, then we're finding that the types of programs are collecting more in the moment type of information. So getting mood ratings, for example, right in the moment where a person is at. It's more interactive. It's using that data to tailor the types of skills and prompts for people to work on. And it's simply a lot more portable. So we've moved from having to sit at a desktop computer, which were the old ways that we used to do e-therapy, to more in-the-moment app use, because over 2 billion of the folks on the planet have iPhones or smartphones to some degree. So that's where e-therapy is really being delivered now.
I think we need to pause for just a second here because we're at 7 minutes, even with my flubs in there. And we still haven't done any of the 3 e-therapy programs. So we
Yes.
don't have this one scheduled yet, do we?
We don't. We can take it to 2 segments.
I think we should probably do 2 segments with it, and then we can use the second to talk about these 3 different programs.
Yeah, so I've got 4 programs, so we'll see what kind of with 3. So there's the Shut-Eye one.
Shut-Eye. I've
Yeah.
got Mayo's Child Anxiety
Anxiety.
Exposure application.
Yep. We'll call it the Mayo Clinic Anxiety Coach.
Okay.
So if you can change that, Mayo Clinic Anxiety Coach.
That's the child one.
We're actually using it for adults as well
Okay.
too. So Mayo Clinic Anxiety Coach. So then that way, if they look on the App Store, they'll be able to find it.
Okay.
And then if we wanted to do 3.
I've got work on stress management, bipolar alcohol use.
Yeah, so the stress management one is kind of like the ultimate low key app
Okay.
that probably won't cause any problems.
Okay, so that's a starting spot.
So that could be a starting spot.
And what's that one called?
You can find those for free pretty much anywhere,
Okay.
anytime. So when something's a little bit more formal, like anxiety, depression, then true insomnia, that's where Shut-Eye. One of the ones, and we can either do it one of 2 ways. One that's related to Shut-Eye, where you're sitting in front of a computer and you're working on it over a period of time, is Beating the Blues,
Okay.
which is developed out of the UK, but also
Yeah.
being done in the US.
So here's what we need to do. We need to wrap up the how has it evolved over time type of a thing, which is where you're getting to the end of that right now with the
Yep.
mobile interventions. And then we'll say, let's take a break. We'll come back and talk about the specific e-therapy programs that are being used. And then we can,
Sounds good.
Can you turn mine down just a little bit? I think my
What?
hearing's getting better as I get older.
oh, thanks, Garrity.
Or he's carrying less.
That's Garrity helping you out on that
Perfect,
one.
yeah.
Okay, very good. Okay, Ernie, you're going to love this one. So much editing options.
Gives you stuff to do.
Yeah. Okay. So let's just, anything else to say here for the mobile, or I'm sorry, the different, how it's evolved over time
No,
before
I
we
think-
launch into that?
No, I think that's totally
Okay.
fine.
Okay. Go ahead.
What am I supposed to say? So, Dr. Sawchuk, these e-therapies are fairly new on the scene, and they're available to most anybody who has access to a computer or a cell phone, smartphone.
Very much so. So there are still some e-therapies that are available on typical internet websites. But as we're seeing the explosion of a number of these e-therapies available on the App Store, and we can talk about some of the differences, some of the advantages and the disadvantages between the 2 formats.
All right, Dr. Craig Sawchuk, psychologist at the Mayo Clinic. We need to take a short break, but when we come back, we're going to be talking with Dr. Sawchuk about some specific e-therapies that are available right now. Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
We're talking with psychologist Dr. Craig Sawchuk about e-therapies. Dr. Sawchuk has told us that the incidence of mental illness in this country is as high as 30% over a lifetime. He's also told us that there are a lot of people who are not getting actual face-to-face evidence-based help that really would help them. And so now we're talking about an alternative called e-therapies.
And two different types. There's the internet type or the app type. Let's start with the internet types. What does that mean?
Right. We'll start off with the internet types, where typically the internet-based e-therapies are the ones that have been around the longest now, and they do tend to be a little bit more labor-intensive. They do require folks to be sitting in front of the computer for extended periods of time, which is very different from some of the app-based ones that we'll talk about in a moment. Two of my favorite ones, and ones that also have a good amount of evidence in the literature, and that is extremely important that we look at, what is the evidence base for these programs. One is called Sleep Healthy Using the Internet, or Shut-Eye, and that website is www.myshuteye.com. And that really focuses in on evidence-based treatments for insomnia. And we know that insomnia is a very prevalent condition, can directly, increase risk for anxiety and depression in the population. And doing a great behavioral treatment for insomnia can be extremely helpful.
Except for, I thought that if you've got insomnia, you're supposed to stay off your screens.
That's right. You do it during the day,
Okay.
or don't get on shut-eye before an hour, no more than an hour before you go to bed at night. But this is basically it's a 6-week type program where it really tracks certain sleep habits, gives you ideas for improving the quality of your sleep, but really works at some of these behavioral skills like stimulus control and sleep restriction that are known to be very, very helpful components for managing sleep.
Shut-Eye, SHUTEYE.com.
No, it's MYSHUTI.com. So that's Sleep Healthy Using the Internet.
My Shut-Eye.
MyShutEye.com.
Gotcha. All right, so
Yeah,
that's
not EYE, it's I.
Yes.
Okay.
It's
Now,
always
so
the
who
acronym.
sponsors this? Who sponsors the program? I mean, how do they get funding to do this?
So this is based on just randomized trials that have been developed over time, because we've learned what evidence-based principles work face-to-face for the behavioral management of insomnia, and then a group of researchers to try to improve the access to that, develop the internet website. Now, the trick is that developing an internet-based platform needs to be done in an evidence-based way in a randomized trial. Does it do just as well or comparable to a face-to-face intervention? And Shut-Eye has excellent outcome data on that.
What's the other internet-based program that you recommend?
The other one is actually out of the United Kingdom, called Beating the Blues, and that's www.beatingtheblues.co.uk. And this is actually also being piloted at the University of Pittsburgh by Bruce Rollman and colleagues out there. And this really formally goes after anxiety and depression, and really focuses in on exposure-based skills to help with that avoidance behavior, scheduling more meaningful activities. When we're depressed, we tend to withdraw. And in particular, teaching people ways to challenge and manage negative styles of thinking.
And that one works.
That one works. That can be helpful. We found that with some of the research, when they've compared just the user logging in and using it, can lead to okay outcomes, but those outcomes can be enhanced when you have like a nurse care coordinator or an additional coach just encouraging people to log in on that,
Sure.
and then maybe setting some goals for some feedback.
Is there a cost for Shut-Eye and Beating the Blues?
Yeah, there is a cost for Shut-Eye.
Okay.
And that one, I think, runs about $135.
Okay.
And I think this is something that insurance companies need to take a close look at, that, boy, wouldn't it be worthwhile covering the cost of that program as opposed to paying for medications to be managed for insomnia, or even sometimes to see a behavioral therapist face-to-face? space.
And
Well,
beating
there's
the
where the
blues?
money comes from.
Yeah,
So,
that's the money.
Okay, so
What
there's
about
the
beating the
funding.
blues?
Funding comes from the patient.
Yeah, and beating the blues actually is more about are you working with a provider who's linked to that program and they can get you in. So there's a little bit more complexity with beating the blues. It's not a full consumer-based type of platform.
But it helps to, if someone would like to use that, that's a good thing that you could start off with for your provider to get you there.
Exactly. And going to that website will give you some additional information, and that is an 8-week program. So there's
Okay.
8 modules
And that
for
is
that.
beatingtheblues.co.uk.
That's exactly
All
right.
right, now let's talk about apps,
All right, apps.
not appetizers.
That's well, we got that coming up for the Christmas
Okay,
season,
all
so
right.
that'll be good.
So what do you have, or what do you suggest when it comes to the apps that you use on your smartphone or your device?
Yeah, apps are really the way of the future that's going. And I mentioned a few moments ago about the evidence base. We have to remember that apps are also proprietary. So there's a lot of time apps being developed by non-psychologists that are not necessarily
Okay.
evidence-based. So we have to be careful about that. But there are 2 apps that I think are absolutely great. One of them, to reinforce the great work that Mayo has done, is called the Mayo Clinic Anxiety Coach app. And this has been developed by Dr. Stephen Whiteside, who's a child anxiety expert here at Mayo, but also internationally, and his colleague, who is an adult anxiety specialist, Dr. Jonathan Abramowitz. And this, I think, really represents how apps should be developed, that this is done in an evidence-based way using evidence-based principles, and especially it's focused in on anxiety, and the number 1 treatment for anxiety disorders is exposure therapy. So the great thing about these apps is that you can actually use these apps to develop an exposure-based plan. What are those fears that you're going to face? It gives you ideas and can tailor ideas of how to approach your fears gradually rather than head-on and being overwhelmed by them.
Is anxiety a bigger problem or depression a bigger problem in this country?
Anxiety is a bigger problem.
Wow.
However, the actual costs of impairment tend to be higher with depression, but the rates of anxiety disorders are higher.
And how long has this Mayo Clinic Anxiety Coach been around? I've never even heard of that app.
Yeah, it's actually been around for a couple of years,
Okay.
but they're doing a lot of research on that app, and we're hoping to develop it or implement it into our programs, our regular clinical practice as time goes along. But the great thing about this app is it's tailored to the individual. It helps them focus in on goals and progression towards those goals, and they can actually use tips and tricks with that app right in the moment.
All right, is that a free app or is there a charge for that?
I believe there's a charge for that. I think it's about $1.99 or $3.99.
Yeah,
so you
that's a
have
good
to,
thing about apps. They're usually pretty reasonable.
yeah, very reasonable there, but evidence-based and really good stuff there.
All right, the Mayo Clinic Anxiety Coach. And what's the other app you recommend?
Well, the other app is coming full circle around is when you're talking about some of the data coming out of Northwestern University is they have a suite of different types of apps called the IntelliCare app. So again, this is through the Northwestern University. And they've got almost like a salad bar of different apps. So this, once again, I think gets to the consumer in terms of what do they feel they need the most help with. So for example, they have an app, a specific program within that focuses in on sleep and sleep management. They also focus in on strategies to learn how to manage worries in the moment, getting connected with meaningful social contacts, breaking out of the cycle of isolation. So I think they have a suite of about 12 or 13 different apps to choose from. So once again, you think about it from the mental health consumer who would use technology, they're looking for things that are very specific that they can use just for a few moments at a time, and this is a great option for that as well.
So what does the future hold? What's ahead of
What's
us?
in the pipeline?
Well, more as you're seeing that the sophistication is dramatically increased is, and these apps collect a lot of data on folks. So I think what we're going to find is they're going to become progressively more and more interactive. What's going on in the research community now is 2 particular populations are being studied with the use of mobile apps. One is bipolar disorder, and the other are various substance-related problems. And what I absolutely love about the research that's being done in this area is they're trying to help those folks with great coping skills right in the moment in which they need it. Because both with bipolar and substance-related problems, their triggers sometimes may come out of the blue. And sometimes they need assistance right in the moment to offset relapse or acting impulsively. So these are excellent apps that I think are going to have a lot of promise going forward. The trick of it is that this is a proprietary business. So there's lots of companies that are developing apps that look like, or they're at least sold as being evidence-based for the treatment of anxiety, depression, or other mental health problems, when essentially they lack any evidence base whatsoever, or they may not even have psychologists, behavioral psychologists involved in developing these apps. And it's hard, understandably, it's hard for the consumer to be able to tease that out. But the applications that are linked with universities stands a much better chance of being much more evidence-based.
I can see how someone, though, might be a little bit nervous about just grabbing an app out of the App Store.
Well, there's hope for people who need it. Mental health and the use of e-therapies. Psychologist Dr. Craig Sawchuk, thanks so much for being with us.
All right. Thank you for having me back.